Time now for our Listen Up segment, where we debate an issue of public interest. Tonight's proposition comes from the drugs policy campaigner Peter Krykant.
Safe drug consumption rooms should be legal in Scotland. Our country has the worst drug death rate in Europe, and Glasgow has the worst ongoing outbreak of HIV in 30 years, condensed amongst public injectors. Safe drug consumption is an evidence-based way to reduce the harm inflicted by drugs and is used around the world with no recorded deaths to date. It keeps the public safe and our city spaces greener, lowers hospital admissions due to infections and fewer ambulance call-outs, which save councils and the NHS money. It also offers drug users information on treatment and increased contact with services like housing and welfare. Safe facilities help keep people alive, stop virus transmissions, save government's money and directly support already vulnerable communities. There is no logical argument against safe drug consumption rooms.
And Peter is here now to debate his arguments with the former Labour MSP Graham Pearson, who had a long career in the police, which saw him head up the Scottish Crime and Drug Enforcement Agency. Thank you both very much indeed for joining us. Peter, what you're proposing do exist in other countries. Here's some pictures of a facility in Copenhagen. Can you explain how these rooms work then in practical terms?
Yes, certainly. I mean, I actually visited Copenhagen facilities about 4 or 5 months ago now, and what they offer is a way that people can come in, they can bring their own drugs into the facility, they can use them in safety, they can have support from people in terms of health and welfare, social support, add-on benefits for engagement with treatment for people that may have not engaged previously. So there's a whole range of benefits. Copenhagen actually reported an 82% reduction in discarded equipment, and when I spoke to the police over there, they said it's the best thing that's ever happened. They no longer find dead bodies in the street.
OK, Graham, what do you think of drug consumption rooms as an answer to Scotland's, terrible drugs death problem?
Well, I think that it's like so much of what's been done over the last 25, 30 years, there isn't an answer in isolation to our drug problem in Scotland, which is the worst in Europe. It's the worst in the developed world. I also have visited drugs consumption rooms in Europe, and my visitation unfortunately wasn't as positive. What I found was that the people in the consumption rooms were well-meaning and hard-working, but the rooms were overflowing with the client group to the extent that people were sitting out on the pavement outside and consuming drugs on the pavement as people went by in their day-to-day business. The key to any strategy going forward is not to put all our eggs in one basket and say the consumption room's the answer. What we need in Scotland is a genuine commitment to a coordinated system which brings people out of drugs and gets them back into a healthy lifestyle. And that costs money and means that we need to invest in these outcomes.
Peter, what's your response to that?
Well, I think Graham's kind of hit the nail on the head there. We don't have a magic wand or a silver bullet that's going to solve Scotland's drug death crisis. What we do have is a range of options, and one of those is an internationally recognised way. It's evidence-based, it's happening all over the world, in countries like New Zealand and Australia and Canada. The rooms... The consumption rooms now are at over 100 officially sanctioned sites with not one recorded fatality so far. Scotland, and Glasgow specifically, has the highest HIV outbreak in the last 30 years just now in the city centre. But
what about what Graham said, that these rooms he saw were overflowing? Who's to say that might not happen here?
I mean, that's a capacity issue. If you look at H17 in Copenhagen, which we just saw the pictures of, they're not overflowing because the capacity can be adhered to there. They've got enough workers there, they have enough space for people to come in. The businesses are flourishing around the consumption facilities.
Can I say one of the issues here is we don't actually understand the problem in Scotland yet. We don't even know the scale of it, and we don't know how much money we spend in trying to resolve it. So 25 years ago, we were told, a guesstimate, finger in the air, 55,000 problematic drug abusers in Scotland. Currently, the last figures that I could ascertain said it's between 55,000, maybe 58,000 problematic drug abusers. And we need to try and get a scope of what it is we're trying to deal with here, and then put in the services that can get people back into health. For instance, when they want treatment, get them the treatment. Not tell them it's not available for the next 6 weeks, we'll get you an appointment and maybe we'll get you rehab then.
But in the meantime, could this not be part of the solution?
Well, the government needs to come up with a policy that tells us what is the size of this facility, how much is it going to cost, will it have the right medical support to help those who are working there? Will they have access? They come out of Barlinnie and don't get a house when they come out of Barlinnie, having done months and sometimes years in prison. Visiting a drugs consumption room of a Wednesday afternoon, who's going to be there to say, I can get your house and we'll get it for you tonight? And unless we begin to get these solutions, we're going to continue to invest in a problem for the future, and it doesn't speak well for Scotland.
Yeah, and I think that's already been done. You know, the data's there. You know, the NHS Greater Glasgow and the Scottish Government are in full support of these consumption facilities. We know that there's about 60,000 problematic or determined as problematic drug users in Scotland. The problem is only 20,000 of those people are actually in any form of treatment. What a drug consumption facility does is it actually engages people so they can get support with housing and welfare, they can get social services support, they can get add-on support for drug treatment. So people are walking past the consumption facilities that Graham spoke about using outside them. At the moment, people are walking through lanes having to walk over discarded equipment in Glasgow city centre. That wouldn't be there anymore. We know that the people who are publicly injecting in Glasgow would use these facilities. A massive piece of research has just been carried out. Research is actually coming out of our ears in Scotland. It's time we took some specific actions, and the Lord Advocate needs to step forward to make those changes, because the UK government won't.
Specific action, exactly. And Peter, at the moment, the UK Home Office, as you say, is not allowing drug consumption rooms. But in recent weeks, you've been out in the streets in your mobile consumption van, if you like. Have you had many addicts coming in? What kind of reaction have you had? Yeah,
I mean, the reaction's been great. I mean, on Friday, we had 9 people use drugs much more safely. They all had clean injecting equipment. We had naloxone on site, which reverses an opiate-based overdose, so we can keep people alive. On a day that my van was out, when the police were monitoring it, I heard that a young girl of 17 years of age died in the city centre. If she had been in the facility, she would be alive today. That's what we're dealing with. People are dying. We're talking about 1,500 people a year now. Yeah, Graham, what are your thoughts about Peter's van?
Well, I think that what Peter's done, I know that he's well-meaning and he wants to try and be part of the solution, but what he's done is he's placed the police in a difficult situation because they've got a law there to enforce currently, and they've obviously decided that it would not be convenient at this stage to enforce that law. It's really in the hands of the Lord Advocate to issue guidelines to the police which allows the facility to operate without intervention from police officers in terms of trying to charge someone. Now, a lot's said about places like Portugal, for instance, and they talk about drugs being decriminalised in Portugal. If you're caught in possession of drugs in Portugal, you're still detained by the police. The drugs are weighed to find out if they are over or under a certain weight. If they're over the weight, you're still charged. If they're under the weight, you're still diverted to a panel to try and ensure that you come off drugs, and you're duty bound to try and cooperate with that panel. So it's not quite a black and white that suddenly all bets are off and you can now carry drugs through the city and you're not subject to police interest.
We will have to leave it there. There's no easy solution to this problem, is there? But thank you both very much indeed for coming in this evening.
Thank you.